Pay culture. Just because it's called a medical procedure doesn't mean it's any less violating in every other circumstance. It's our pay when a woman is coerced into letting something be done to her body that she doesn't want. Yet, we live in a world where women are told that they have to have a violating procedure done to their body, that they don't want it. Shouldn't be a choice of get violated or get cancer. That is not a choice. With the state of modern technology, there should be an alternative to a pap smear. There isn't, because we live in a male-run society that caters to our pay culture.
First of all, let's demystify the medical jargon. A pap smear, or pap test, is not a test for STDs, and it's not just a routine checkup for the sake of it. It is a specific screening method used to detect cervical cancer and precancerous cells on the cervix. During the procedure, a doctor uses a tool called a speculum to open the vaginal walls, and then takes a tiny brush or spatula to gently scrape a few cells from the cervix. Those cells go to a lab to be looked at under a microscope. Is it comfortable? Absolutely not. Is it a walk in the park? No. But its literal singular job is to catch cellular changes before they turn into life-threatening cancer. But let's be crystal clear about something. No medical procedure is mandatory. You have complete bodily autonomy. You are a patient, not a passive bystander in your own healthcare. You have the absolute right to say no, to walk out, or to delay a procedure. You can refuse a pap smear. You can ask for a smaller speculum. Yes, they come in different sizes, including pediatric sizes, and you have every right to request one. You can ask the doctor to stop at any point during the exam. If a healthcare provider makes you feel trapped, coerced, or ashamed for questioning a procedure or wanting to skip it, that is a bad provider. Period. Medical consent must be given freely, and it can be withdrawn at any second. The video you watched earlier highlights a very real, very raw emotion. For many people, the procedure feels deeply invasive, clinical, and vulnerable. For survivors of S-Threx-UL trium, it can be downright triggering and re-traumatizing. Acknowledging that discomfort is important. We shouldn't pretend it's no big deal. It is a big deal to a lot of people, and the medical community historically hasn't always been the best at practicing trauma-informed care. The good news is that if you are at average risk, modern medical guidelines no longer require a pap smear every single year. For many age groups, it's now recommended every 3 to 5 years, especially when combined with an HPV test. Your body belongs to you. If you choose to get a pap smear because you want to stay on top of cancer screenings, that is a smart, proactive health choice. If you choose to delay it, refuse it, or demand an alternative like an HPV self-test because the standard procedure causes you severe distress, that is your right as a human being. Don't let anyone pressure you, but don't let viral videos scare you out of life-saving medical care either. Get the facts, know your options, and find a doctor who actually listens to you.